Yay! I literally put this slide in after last week when I forgot to do that. That's in for me. That's not for you guys. Okay. Now, wrong button. Okay. There we go. So, everybody, welcome to Scar Tissue 101. I'm going to exit and come back in. Okay, 35. Welcome to Scar Tissue 101. I am Marjorie Brook, if you guys haven't figured that out yet. For those of you who don't know me, I am a massage therapist who hails out of New York. I have been working with scar tissue my entire career for over 21 years now. And I have been going all over this beautiful earth and teaching amazing therapists from all over the world, and doctors and OTs and nurses, everybody, about scar tissue. Okay, and what I wanted to do with this is because, as I said, scar tissue is starting to become a more popular thing. I'm seeing courses popping up everywhere. I'm seeing tools that everybody's using. And I just wanted to kind of bust some myths and open up some information about scar tissue. For those of you who are not therapists that who are joining me, don't worry about it. We're not getting technical. We're just going to give you some basic information. You're more than welcome to ask questions as well. Okay, this is for everybody. So, to some people, right, their scars are trophies or war wounds to be proud of. There's actually Facebook pages where people are showing off their scars. To others, scar tissue are a very big source of physical pain. Okay? For others still, they are reminders of trauma that they wish they could forget, but they can't. Okay? And then also, something they have, it's for other people's scars, or something that they have already forgotten about and are totally unaware of how the scars are affecting them. You all know that people leave things off their medical history. I'll have someone, I always ask, you know, have you had any surgery? And they'll like say no, right? I've now learned to add to my medical history, besides have you had any surgeries or accidents, I put in, please list any and all medical procedures. I literally had a woman say to me once, well, I haven't really had any surgery. Well, they did take out my uterus, but they did it through my belly button, and that doesn't really count as a surgery. Trust me. Also, just to give you guys an idea, 6 out of 10 women who come into my office who have had C-sections do not consider their C-sections a surgery. They consider it giving birth. They gave birth. So if they're not even considering the fact that they had surgery, you can imagine the lack of rehab that begins, they're even more so, they don't consider that they need it. So just to understand that there's a lot of different things going on with scar tissue. Okay, nobody else is buzzing in, so this is good. The truth of the matter is, scars and the restrictions they cause can affect every single system in the body. And I mean every single system. It's not just superficial that they see. It's just not of what they, you know, which is what most of your clients are concerned with in the beginning is the appearance of the scar, because most of them are very much unaware of the fact of how the scars are actually affecting them. Okay, recognizing this little piece of golden nugget that I gave you can be the key to unlocking mysterious pain and other issues that have been interfering with the body's ability to function and be in balance. Historically, scar tissue has been ignored or been viewed as having non-consequence by the medical profession. Seriously, people, the doctors, so long as, and my nurses can chime in because I know I have a couple of nurses in here, so long as there's no infection and they didn't leave anything inside of you, their job is done, right? They don't think about scar tissue, not before the surgery, not during the surgery, not after the surgery. You know, if you're having any form of abdominal pelvic surgery, you have a 95 to 100% chance of having adhesions in scar tissue. But nothing is done about it. It's no different than all of you who are working with breast cancer and mastectomies. They do not recommend to even talk about lymphatic massage until lymphedema sets in, right? Instead of being preventative and getting, and by the way, FYI, as far as I'm concerned, if you're having surgery and you know you're having surgery, it's not an emergency, you should be getting at least 2 lymphatic massages within 72 hours before the surgery and then immediately after. Because would you not want to bolster and boost your immune system? and clear it out before it gets attacked. And literally, it's a life-saving surgery, but the surgery is an attack on the body, right? So they don't ever even mention that, and it is of no consequence, no threat, takes nothing away from the medical profession to do that. So it can be a real a problem, okay? With all of the current ongoing research and information compiling on the importance of fascia, the medical world is starting to recognize the significance of scar tissue in the body. Some genuinely are and are referring out. Others, though, however, are using them as an excuse. I literally get an email or a phone call at least once a week from all over the world where they've gone to the doctor and said, hey, you told me I'd be healed in 6 months. It's now 9 months and I still can't walk on my knee. And then the doctor says, oh, well, I'm sorry, you've developed scar tissue. Basically blaming the patient for developing the scar tissue as opposed to giving them the therapy and recognizing to prevent that in the first place. So it is being recognized more, especially with all of our fascia congresses. I also know it's being recognized more because I'm seeing more and more styles and therapies pop up to treat the scar tissue. Don't get me wrong. The more therapies and the more ways to treat it, the better. But the misunderstanding and the lack of knowledge in regard to scar tissue, that's where I have an issue, and that's what we're going to talk about a little bit today. Okay? As with most new fields of interest, there have been many new versions of therapy popping up, which for the most part is a very, very good thing. But unfortunately, the negative side of new frontiers is that many therapists and therapies are being administered without proper understanding of the subject matter. Many of you have taken classes where the intro was maybe an hour, 2 hours of information, and then the rest of the thing is all hands-on. Or you have the people in the class who aren't even really listening to the opening stuff. They just want to be taught the hands-on and nothing else. But that's like the worst thing you could do when you're learning a new therapy. You need to understand what you're putting your hands on, not just who and not just like an injury, but what's behind it. I've been a massage therapist. I've been a massage therapist who can speak on occasion, specializing in scar tissue release for over 20 years. In this time, I've seen scar tissue work go from being dismissed by the doctors as unnecessary. I've seen a general population completely in the dark as to what is really causing their issues. And now to the point that it's being considered by the medical profession that it may be a problem to some extent, but they're not really sure as to what extent is going on. Okay. Still, there are many doctors who are ignoring the effects, while some have taken to using it as the excuse that I mentioned, the person putting it back on the patient. And trust me on this, I get this phone call, like I said, once a week. Someone's calling up and they're at their wit's end that the doctors are saying, you know, there's nothing else we can do and there's really nothing wrong with you, so get over it. And that's really not the truth. The internet is now flooded with inaccurate information about scar tissue and ways to cure it. There's literally a guy who has a book out there who tells people to stick themselves with pins. If they don't have any pins, they can use a pen. Like, literally wrote a book saying stick yourself with pins. Therapies are being applied with total lack of understanding of the physiology of scar tissue. Much less, there is little or worse, no knowledge behind the events that cause the scars, i.e. the surgery, the accident, and what the procedures actually did to the body. For example, I mentioned C-sections before. The first question that I ask somebody who's had a C-section is, was it an emergency C-section or was it planned? Okay, those are two entirely different situations and surgeries that are happening at that moment, both physically. Yes, it's a C-section, they're removing the baby, but at the rate at which they move and how they do it because of the emergency is much different than a planned, regular, easier version of a C-section. And there's the entire emotional background is completely different between an emergency C-section and a regular C-section. It's not regular, planned C-section, okay? So understanding that. Also, I want you guys to start thinking about this. For those of you who we mentioned mastectomies, for those of you who work with mastectomies, you don't have to answer it now, I'll ask you at the end. How many different ways, surgeries and whatnot, are there to reconstruct after a mastectomy? Think about that, we'll come back to that. And for that matter, for those of you who don't deal with cancer, how many different ways or approaches do they have for heart surgery? It's not just the cracking of the chest and the different entry points. What are the different entry points for cervical fusion or lumbar fusion? Is it all coming from the back or like cervical? Most cervical fusions are done, most surgeries are done for cervical are done from the anterior, not from the posterior. And you should know that, and it's a different procedure and a different thing effects on the body. Sorry, Julie, number 43, who just left because she doesn't like the volume. Sorry about that. Okay, coming back next. Now, no attention is paid to the psychological and emotional trauma surrounding the events which cause the scarring. Why is this important? Because scarring and scars, manipulating, touching scars can trigger PTSD. How many of you have worked with clients who have never even touched their scar? They're so grossed out about it, or there's so much emotion behind having to have a mastectomy and what has now happened to their body. Having a C-section. I had a 21-year-old on my table who had had heart surgery, open heart surgery when he was a baby, and he's 21 now and a male, and he had never, ever touched a scar that was running down the center of his chest. And honestly, there is no part of your body that you should not be able to touch, right? That is making a disassociation between you and your body, and that shouldn't happen, okay? You look for the possible compensations that the body may have compiled in response to restrictions and what releasing those restrictions without proper rehab would do. In other words, if someone has say a C-section, that C-section may be pulling this person down or turning their pelvis out or not allowing their pelvis to come back to the reform and reset after the pregnancy. Maybe you have someone with a mastectomy who can't open their arms all the way, or they're being pulled forward, or they can't lift their arm overhead, all from the pull of the surgery. You can have people who have had foot or ankle surgery, and now everything in their body has shifted because they're no have the way their gait was. You guys want to know the first question that I ask someone who's had breast implants? We're not talking about reconstruction, just someone who's had implants. The first question I ask them is, do your feet hurt, or do you have issues with your feet? Which you would think would be a weird question to ask someone who's had implants. But the fascia, as those of you who know, the fascia lines go all the way down from top to bottom. That you're putting a restriction in onto the breast, and your is now doing a pull, and that pull ends up most likely in the feet. And I will tell you, probably 60% of women who go up a size or more with implants end up with neuroma, which is an issue down at the bottom of the foot. So all of this, this lack of understanding, right? And people just jumping at scars, thinking that they should just put cups on, put blades on, just work the scar without an understanding, it honestly terrifies me. Now, don't get me wrong. I'm not saying that you should never massage a scar or never work on a scar. That is not what I'm saying. What I'm saying is you need to have an understanding of what's going on that caused that scar, all the events that led up to that scar, right? That's all I'm asking, okay? Because of all this, I thought I would take a moment to clear up some of the misinformation about scars, okay? First off, this is one of my biggest pet peeves. My students on here will back me up on that. Scar tissue cannot be broken down, nor can it be removed by anybody other than a surgeon. Anyone who claims that they're breaking down scar tissue does not understand what scar tissue is, okay? Okay, so scar tissue is not to be confused with adhesions. That while we still need to work on adhesions, there's a difference between scar tissues and adhesions. Because you can have adhesions without a scar, but you cannot have a scar without adhesions, right? Adhesions is the body's response to inflammation. So you can twist an ankle, you can bang something, have some inflammation, and adhesions can form. But you might not necessarily have a scar there. Whereas if you have scar tissue, you had an accident, you had a surgery, and you've broken the skin, and the skin has to heal, you are going to also have adhesions, okay? There's a difference. Okay, now scar tissue replaces normal tissue that is damaged. If you break it down, you're essentially saying that you were causing a new wound. Okay, scar tissue replaces normal tissue, right? So on the surface, and so basically the thing that you have to understand though is that scar tissue at its best is only 70% as functional as normal tissue. At its worst, with people, when there's no therapy and the person has the way their metabolism is, the way they've healed, the scar tissue could be functioning at 10 to 20% or less. So it's our goal when working with scar tissue is to release the tissue and get the tissue functioning as close to that 70% as possible, not to break it down. The only people who can remove scar tissue is a surgeon. They're going to go in and cut it out. And if they're doing that, they're just leading the body for what? More scar tissue. Okay, so we want to try to avoid the scar tissue removal surgeries. It's also very big with our knee replacements and our hip replacement, that if they don't get the range of motion that they're looking for, and now they've cut the window down even sooner, is they'll put them in under anesthesia and then force and break everything down, which is a very violent, the knee surgery is violent to begin with, but that procedure to go in and release it and break off the scar tissue that way and force the knee to move is also very, very traumatizing to the body. It doesn't matter that the person is unconscious. The body still feels and remembers everything that's done to it. Okay? So the goal of working with scar tissue is to release the adhered layers. We are layer upon layer. If you think of us as pretty much, oh, I'm hearing a lot of background noise. Okay, so someone just requested that if you've got a lot of noise behind you for the moment, can you put yourself on mute? If not, I'm going to mute everybody. So whoever's got the noise coming, put yourself on mute for a little while. And if it keeps happening, Tanya, I'll mute everybody till the end of the. That's better. Okay. So our goal with working with tissue, right, is to release the adhered tissue. We are layer upon layer upon layer upon layer of tissue that is supposed to slip and slide. When we have scar tissue, when we have adhesions, all of a sudden that tissue is stuck and not moving. Right? Our goal is to get those tissue layers separated and moving, not to break them apart. Okay? We are going to be attempting to reestablish homeostasis. We're trying to get the body functioning the way it was designed to function, not the way it's being forced to push through the scar tissue. For many of you who don't realize this, scar tissue acts like a dam, and it doesn't allow fluids and gases and energy to flow through. It also, if we want to talk to more polarization people, those in polarity therapy, the electromagnetic current that runs through our body is negative. All of you should know that out there. However, what most people do not know, and doctors don't know, is that when scar tissue forms, it forms positively charged. So therefore, it's interfering with the electromagnetic energy running through, not just the overall body's energy from our Reiki people out there. Oops, somebody deny that. Not just the overall energy flow. Everything is being blocked, or not completely blocked, but just enough that there's enough flowing through, but not full, and causing ischemia and other issues in the area. Those are just a couple of things that's happening with the homeostasis of the body. So our goal also is to release and correct the compensations from the restrictions. So many people, they go in, they massage, they cuff, they blade, they do whatever they do, and like, okay, release scar tissue, go on your merry way. But you can't do that. You have to stop and check what has the compensations happened because of the rib removal and the scar from the lung removal that's going from the center of the breast around to the back. The person bent forward, or because of the C-section and the mastectomy, they've been forward this whole time. Because of an amputation, not just the fact that the leg has been gone, the compensation, but the pull from the scar tissue from the amputation. If someone's had a mastectomy rebuilt, did they lose a piece of their lat? Did they lose their glutes? How is the body compensated besides the scar tissue from all of that? So we need to make sure that we reset all of the compensations that have been caused by the fascial restriction. So it's not just about working the scar tissue. It's about rehabbing the body and setting it as close back to factory settings as we possibly can. Okay? And then all the while that we're doing this, we need to be acutely aware of the possible emotional releases. Okay? Here's the thing, ladies and gentlemen. As massage therapists, I know I have PTs and nurses in here as well, but then massage therapists have a tendency to say the issue is in the tissue. Okay? That is not true. The issue is in the brain. The trigger is in the tissue. Okay? It's like the same thing. Like, for example, if you have a smell and it sends you back to a memory or to a place and a time. You're not going to say the issue is in your nose, right? The memory is in your brain. The smell triggered the memory. When you manipulate, press on, pull, or release scar tissue, you can very easily send somebody back to the time of when they received the scar, whether it's the surgery, whether it's the car accident, whether it's the fire that they were burned from. And you can even send them either afterwards. They can go back to a rehab moment afterwards when they struggle through. They could be sent into an emotional thing of thinking about the way they were treated. Like those dealing with mastectomy, a lot of women have a lot of pressure on them to rebuild, right? And you can send them to a conversation that they've had with theirs. So you're never quite sure. Working with veterans, you could trigger PTSD beyond with them and send them back into when they were in active duty. So the reason that I'm bringing this up is that with most of us that are therapists, we're told that our work elicits emotional responses, but then it's out of our scope to deal with them. It's how you deal with them, right? Making sure you know the right words to say. I'm not saying be a therapist. I'm saying know the right words to say. Somebody definitely has a mic going, so I'm just going to mute everybody. Hold on 1 second. It's not letting me do that. Hold on. Let me see for 1 second. Mute everyone. Okay, so I'm muting. Okay, now we've got some silence going on because it was starting to get to me. Sorry, everyone. You can send people back. I'm not asking you to be a therapist. I'm not asking you, but there's many things that you can do to understand about emotional releases. You can refer people out to groups. I have, like, for example, if someone's having a really emotional time when dealing with a C-section, and let me tell you, not only do women not consider it a surgery, they do not ever really talk about the situations of having a C-section, like what it meant to them that they didn't get to have natural birth. Many women feel that they failed as a woman because they had to have a C-section, even though it was completely out of their control. So I'm not going to play shrink, but I am going to refer them to ICANN, which is the International Caesarean Association Network, which is not only live meetings in every state, it also has chat rooms, and you can go online, and then they can go in and see that they're not the only person that feels this way and that they're not alone in their feelings. I didn't break my scope of practice, but I furthered people on. The other thing about our patients having emotional releases is that we ourselves need to be prepared, right? Just for our own protection and our own well-being. Many therapists are not ready for the reactions that they're going to get. People breaking down crying, people getting angry and yelling. I can give you 1,000 stories right now. So it's very, very, very important that you be aware when being treated, and those who are doing the treating, of the fact that you can trigger emotional responses. Okay, so, oh, come on. So there we go. Another very big thing that is not true is that they say scar tissue is dead, fibrous tissue. No. Scar tissue is a composition and structure that are different from the normal tissue, as I mentioned. Okay, because of the changes in the relative amounts, type, and structure of the collagen, it's inferior in function. As I said, it is 70% as functional as normal tissue. Okay, things that make it different. Scar tissue has less elasticity. It doesn't have the ability to expand and come back. Okay. Scar tissue is not as strong as normal tissue. There's a fallacy out there, a myth. Many people think when a bone breaks and it calcifies over and it heals that the bone is stronger. That is not true. The bone is weaker. Okay, and it's the same thing with scar tissue. Because of the chaotic way that the fibers are forming and the cross tension pulls that is causing, it is not as strong and more likely to tear or cause a problem. Okay. Also, scar tissue does not oxygenate well. You know, because oxygen is being limited, because circulation is being limited through the area, you're going to be creating a low acidic pH environment, which is never good. You're leaving, that's where cancer thrives. That's where a lot of bad things thrive. We want to have a nice balanced pH in any environment throughout the body. Okay, come on. Oh, next button. There we go. Scar tissue is different neurologically. Okay, scar tissue can transmit pain way faster and more intense than normal tissue. Okay, You've heard of people who have had scars and they can't stand anything touching it. Their clothes, a lot of women who have C-sections can only wear very loose pants. They can't wear anything tight or anything that pulls up against the scar. People will tell you that scar tissue is itchy all the time, even years out. They'll tell you that they're numb. If they're numb, that's because the scars, the nerves which were affected during the surgery did not get a chance to reconnect properly, or they're bound up in the scar tissue. There's all different ways that scar tissue is different neurologically that people don't pay attention to. And when the client or the patient complains of pain or lack of pain, lack of sensation, they just say, oh, well, I would say probably 50% of the women who've had C-sections or hysterectomies, from the scar to the pubic bone, they're numb. They don't feel anything. And you can fix that in like 2 seconds doing scar tissue work, very quickly. Releasing the scar tissue, the sensation comes right back as you've released all of the bound up nerves in that area. Okay. Scar tissue does not contract. You know that our fascia or tissue expands and contracts. Scar tissue does not contract. It moves through tension force. It does not contract. Okay, scar tissue is less resistant to ultraviolet radiation. So what most people do not know is that for the rest of their lives, they have to wear a sunblock on the scar. If they're sunbathing and they like to oil up or be out in the sun, the scar must always have sunblock on it. Otherwise, you're leaving yourself open for cancer from that as well, and other issues, and changing the color and the presentation of the scar. Scar tissue does not contain sweat glands or hair follicles, which leaves the skin vulnerable. And scar tissue is prone to injury. If you have something that is not functioning normal, is not contracting, is not has no elasticity, is neurologically different, you are more than likely prone to re-injure or have a different type of injury due to all of those compensations and lack of function in the area. Okay. Scar tissues are only an aesthetic issue. Okay, most people are only concerned with how the scars alter their appearance and have no idea how the scars and adhesions are affecting their bodies on so many different levels, or that scars can be a major trigger of PTSD. I've had people that they would have get angry and they don't know why they're getting angry, or they're very sad. And basically what's happening is they're putting pressure, like the clothes, the pants they're wearing, or the shirt they're wearing, the bra they're wearing is putting pressure on the scar. And it's causing a reaction that they don't understand unconsciously. I've had people reaching for a can of peas, and that action pulled the scar, and then all of a sudden they have like a flashback, or they don't understand why their mood changed, and they're like just annoyed with everybody right now. And that's because the scars have those effects. I had one client who was a model, absolutely drop dead gorgeous. She had a surgery she didn't need, did not give her the whole surgery, but it left a tiny little scar on her cheek, which you wouldn't even notice. It looked like a dimple when she smiled, but she was very, very upset about the scar. The scar was left over after having 5 surgeries to repair her face. When she came to me, I said to her, are you having any TMJ? And she's like, yes, but I don't care about that. I just want this scar gone. I asked her if she was getting migraine headaches, because you could feel the scar tissue was going up into the temporalis. And she's like, yeah, but I don't care about that. I just want to get rid of the scar. And she had so many other issues, sinusitis, everything, because the scar tissue had attached itself and spread throughout the entire right side of her face. And she didn't care about any of that. After, when we released the scar and got the scar diminished so you could barely see it, then she was very happy over the fact that all the other things were gone. But she never associated any of that stuff that had been occurring as being part of a result of the surgery. Okay, she just wanted her face back. And that's the other thing as far as emotional level. Some people, they're very concerned with their looks, and the scars are just, ruining. They see it and it sends them. I can have someone who has a minor scar and you don't really see it, but when they're in the shower in the morning, they come out, they're drying off, they see the scar, boom, they're sent all the way back to the PTSD. To the situation where it occurred. This happens a lot with any of my patients who've had radiation, because they get the tattooed markers for the radiation. They'll put the dots on, and even though they beat cancer and they're fantastic, I have one person, when he sees the scars in the morning after the shower, he's like, yes, I won. Where I have another person where every time she sees the scars, the tattoos from the radiation, it puts her right back on the table getting the radiation. So it depends on the person. Not everybody has a bad reaction to it, but it can be an emotional reaction. And it's not just about the aesthetics. The scar tissue can be affecting so many different systems in the body. Okay. Here we go. Anyone can treat a scar. Okay. Acknowledging that scar tissue may be at the root of the problem is the first step in any therapy. After that, simply massaging the affected area can bring about a change. Yes, if you massage an area, if you pay attention to the scar, if you work the scar, yes, you can bring about a change. However, that being said, I want to caution the therapists out there, okay, and for my lay people, understand this. You need to thoroughly understand the event which caused the scar, i.e. the surgery, the accident, and all that goes with it, okay? I have a burn survivor who came to me, and he came to me for stretching. His burn scars were 20 years old, and he'd been living with it his whole life, but he is a CrossFitter, and he was very tight. And so I immediately put him on the table, stretching him, and then I was looking at the burn scar on his leg, and I asked him, is this a full thickness burn? Yes. And he looked at me very surprised that I knew that. And then I said, where was the donor site? And we started talking about the scars, and I said, can I show you something? And I worked the scars, and he was in shock that most of his restrictions were coming from the scar tissue because he had accepted it as his norm 20 years later, and that he figured he was just tight from his muscles. I have another person. I had a chiropractor come to me, and she had a double mastectomy with a rebuild. And as she was explaining to me her situation, she says to me, I didn't have a normal reconstruction. She goes, they took it from my thighs. I said, oh, you had a tug flap. And she said, you know what that is? I said, yes. I said, is it just limited range of motion in the legs, in the hips, or do you have the vaginal pull? And as soon as I said that, this is what I saw. She didn't have to explain. I understood and I agreed, and I knew that, yes, there was a vaginal pull from the scarring, whereas most of the doctors she went to said it was all in her head. Nope, it was all in her vagina because of where the scars are for a thigh. It's basically like a tummy tuck just on your thighs, and the incisions go all the way around at the hip, at the lower part of the hip, around where the legs attach. So that tissue is pulling into the vagina. And it's very uncomfortable and can be very painful if there's any nerves involved. But every doctor she went to said it was all in her head. Okay, so understanding the surgeries, how the procedures were done, the different options for the procedures, and asking why they opted for this one versus this one. Why did you do a deep procedure to rebuild versus why did you take a piece of your lat? Why did you choose to take a piece of your glute to rebuild the breast? Right, understanding all of that and the procedures that they went through, being able to ask the pertinent questions, not only puts your client at ease, but shows them that they've actually come to a person who knows what they're doing. I'm not just going to grab a cup and start working on a scar and go, oh, look, it's better, and not pay attention to all the other things that I could be triggering. Or pay attention to the fact that I've just released tissue and I didn't reset the body, I just let them go, which could either make the body do different compensations and reset differently, or cause more issues or make them deeper into the problems that they're having because the body just retracted off of the scar tissue. Okay. So all of these reactions of understanding the surgeries and what happened is you need to have a very good idea of all the different types of emotions surrounding whatever surgery, accident, or trauma they have. I'm not saying you're a shrink. I'm not saying that you can put yourself and say, I understand, I know what you're feeling. You just have to have an understanding and be prepared for all of that. All of the physical ramifications in the body, which is not just including what type of compensations could be setting from it. You also need to understand from a surgery, what position was the body in during the surgery. Again, we'll go back to mastectomy. In a mastectomy, the arm or both arms are held out for hours on end. So if you're going to work a mastectomy, you can only work for a few minutes and then you need to put the arm back down. You can't hold the patient. I had another therapist who was trained by someone else in scar work, and she called me and said she was having all of these problems. She couldn't get in with a client who had lost a lung. And I said, well, what position is he lying in? She goes, well, on his back. I said, well, you need to put him on his side. I said, he spent the entire surgery on his side with the arm up and over his head. or out in front of him. So they had access to the lung. So that's a different line of tissue that needs to be addressed, which is why she wasn't getting into the issue, right? So you need to understand these things before you just jump your hands in and start working on something intensely or with focus to release, okay? What type of rehab will be needed once the scar massage, scar release is done? What was the compensations? What do they need? And by rehab, is it something that we can do? Like I have my integrated therapeutic stretching and strengthening. Do I need to get them into a support group? Do I need to recommend? I can't get them into. That's overstepping my bounds. So I can recommend what groups do I need to, or what suggestions can I make and say, hey, maybe it's a dietary issue because now, because of the surgery, the drugs they're on actually have limits that they're not even paying attention to. Right? I have a whole big thing where I ask what drugs they're on so that I'm aware of the fact of what those drugs, like for example, if anybody who's on the post-cancer pills, right, that they say they have to be on, it used to be a year, then it was 5 years. Now some people are being 10 years for their life. All of the tamoxifen and all of that causes the body to tighten up, almost like they're being shrink wrapped. So you can stretch them and you can massage them and you can temporarily make them feel better, but they're going to come back in with the same restrictions because that's what the meds are doing to their body. So instead of you feeling bad that you only temporarily can help them, that you can't get them past this point, you have to understand it's not you, it's the meds. Okay? This is for your sake as well as theirs, so that your sanity and your belief in yourself is not chiseled away because you're not making the progress you thought you would. You're not making the progress because you can't. Okay? The drugs are affecting the body in a certain way. So yes, you need to know the medications that they had during the surgery and after the surgery, and if they're on prolonged medications, and how those medications are affecting their body. Okay? Now, I'm not saying because of all that, that one should never massage a scar. I said I teach my clients how to massage for themselves and how to work the scar area. I said what I'm saying is that with all the diseases and disorders and dysfunctions, and yes, scar tissue is a dysfunction and it leads to other dysfunctions, okay? You need to understand what you are working on, okay? All of this before you lay hands on someone, right? If you're just doing a general relaxation massage, yes, you can massage over a scar, but don't go at the scar with the intention to release and work the area if you're not aware. Like, is it a hernia scar? Is there mesh? Is there, or netting, depending on who's listening, and if so, what type? Is it the stuff from 15 years ago, or is it the new mesh, right? There's a difference between the two. If they've had a hip surgery, what replacements? How old is the hip surgery? The fact that the new hip replacements, which give more mobility, are way less stable than the ones where they used to ground those things in cement. They didn't, those were not going to dislocate. The newer ones tend to dislocate. You need to know these things before you put your hands on. All the new hip replacements. There's different ranges of motion that they're capable of because there are different types of hip replacements. You should know that before you work with them and start doing some stretching. All of that from scar tissue, yes. Okay. Physical scars cannot and do not show how much pain or suffering a person has, okay, experience. Every scar has an emotional history surrounding it. You can have shock, you can have guilt, you can have failure. Remember, women who feel they failed as a mom because they have a C-section scar. Loss, detachment, trauma, anger and resentment, low self-esteem, fear, hopelessness, depression, disgust with seeing or touching the scar. They're just like, and just disgusted with themselves or with maybe the situation that caused that they had the scar, or just the fact that they have a scar and they feel that they're now damaged because of the scar. Sadness about the limits the scar is placing on their everyday life, that they're not even really aware of how much is being limited. Humor, yes, there can be very funny stories behind accidents and surgeries and situations that happen. So sometimes people are okay with their scars and they can laugh about their scars. That still does not negate that there could be restrictions and other issues stemming from the scars, okay? The emotions surrounding the physical scars can and do have a direct emotional and psychological effect. It can bring about significant self-image issues and lower self-confidence. Research on the aftercare of burn survivors or others who have with severe facial scarring has proven these facts, okay? It's been documented that in cases of patients with severe scarring suffered from depression either between 13 to 23% of the time, or a post-traumatic stress disorder between 13 and 45% of the time. That's almost half the people with scars are being affected by PTSD, okay? So all of this has to be kept in the back of your head, and actually more in the forefront. You need to be aware of all the different possibilities surrounding the scars, emotional and physical. Now, if anybody needs me to unmute because you have a question, let me know right now, and I'll unmute for a second. Otherwise, I'm going to keep going, right? Okay, nobody's texting in with that, so we're good. I'm going to keep going. Let's talk about all the tools that are out there. We all love our tools, right? Everything fancy. There are many instruments and tools out there that are effective on scars, okay? But they are not the end-all, be-all. Rather that they should be considered part of the therapy. The tool is only as effective as the therapist understanding the application of the scar tissue and how it works. Now, many of you know, I had it in the beginning, that my therapy is called the S.T.R.A.I.T Method that I put together. Scar tissue release and integrated therapies, okay? I use multiple things, multiple approaches, both for working on the scar and for rehabbing directly after the scar, okay? But I have an understanding of all the tools. Many people watch videos. I had a client come in so bruised up, and I'm not just talking the cut kisses, but she was literally attacked and bruised because she went to a spa with her friends, and the person did cupping on her, and she felt it was wrong, and she asked because it was hurting. She asked to take it off, and when she saw all the marks, she asked the therapist, "What is your training in cupping?" And she literally admitted that she'd watched a half-hour video and started cupping. Let's not even talk about the fact that it was a spa and no medical history other than, are you pregnant, do you have cancer, and do you have heart issues? That was the only questions that were asked. And this client has got multiple issues that she shouldn't have had someone unexperienced cupping. People love the blades. The blades are out there. And again, effective tools. I cup. I do gua sha, which is using the spoon as opposed to the blades. I do all of that. Okay, but many people don't understand what they're doing when they start blading and going over and attacking a scar. It's just wrong, okay? Again, an example with cupping. Okay, so for those who are not familiar with cupping, when a cup is placed on the scar, right, and its surrounding area, the vacuum of the cup lifts the scar tissue above and below the skin, essentially pulling them apart so that the fresh blood and lymphatic can circulate freely through them. This improved circulation makes movement easier, and as a result, healing of the scar is induced. Well, that's all fantastic, right? It's a great tool, but then again, you shouldn't just cut, blade, or zap over a scar. First off, some people, when they put the suction on, it freaks them out. Others, you start pulling at the scar and you start lifting at the scar. All of a sudden, they're PTSD. And then the big thing is, let's talk about the fact that people are looking to treat the superficial, the top of the scar. A surgery scar is not just the surface. There's going to be multiple layers of sutures. They don't just take a needle, go all the way down to the bottom and pull up and sew everything together. It's multiple layers of sutures. While the surface may have healed beautifully, you may have one of those suture layers below encapsulated. So that means 5, 10, 15 years, they're walking around with a raw wound that's encapsulated. And if you're going to start sucking up and think, you're going to break that encapsulation. It could be a good thing, it could be a bad thing, but if you're not aware of the fact that you're doing that, that's a problem. I'm just trying to give you guys an example. It's the same thing with my blade people that like to go in and just start scraping. If you're going to use a blade or a spoon, even when you gua sha can be very, very intense. Some people are taught to go very intense. If you want to use the blades or anything like that, you can use them, but you have to go very, very light, almost at a little bit more than a lymphatic level, and start working layer by layer. You can't just take a blade and just attack. And you definitely, for those of you that are doing grafting or anything like that, and you're going over joints, stop grinding. Very, very light. Okay, so I'm not against any therapy. I'm for all therapies. I'm against uninformed use of instruments when you're not quite sure of how to apply them or what you're putting them on. Okay, so there we go. Everybody can understand that. And you need to, again, emotionally and physically, what are the effects if you start sucking and grinding and pulling? Also, for those of you that may be using the micropoint stimulators or any type of TENS machine or anything like that, you can't use 90% of the time those on someone who's had radiation. Okay, you're going to PTSD them back to when they had radiation. Not to say that not everyone who's had radiation will never want to have the current stimulators. No, but you have to warn the person ahead of time and know the fact that this could be a reaction and let them tell you within the second that you start using it, is it okay? Let them know, because some might not say anything because they think they're supposed to suffer through this therapy and you're doing more damage than good. You have to empower your patient to be a part of the therapy. The same with the blades. A lot of people attack with those blades and cause a lot of pain, and a lot of people think no pain, no gain, which is not true. You can be doing, also with the blades, you could be doing a lot more damage to the area. Also, do you understand what stage of healing that person is in? Okay, you have to understand there's different stages of wound healing, and people don't sit still until they're completely healed. There could be one area of the scar that's in stage 2. There's another area of the scar that got pulled and is back in stage 1, and another area that's at stage 3, stage 4, it looks like it's healed. And you're going over the whole thing without understanding that this is a possibility, right? Is it an immature scar? Is it a mature scar? At what point are they in their healing? If you don't know this, don't touch, okay? Right? And you also have to look about how altering that scar will affect the person in the long run. Right? Some people love their scars. They identify with their scars. They identify with their disease or the journey that they've gone through. I have one person who never wants me to touch his scar because when he was a baby, his mother was the mother was holding him, and somebody tripped and there was hot water coming at her, soup, and she turned and they got burned, and he actually for a little while got fused to his mother. So the scars from the burn and the separation off his mother, he never lets me touch that scar because to him, that's a bonding between him and his mother. Okay? But with other people, I do tell him, though, that scar that he has is limiting his range of motion in his arm. He's accepting that. He says, I don't care. Don't touch the scar. The other thing is understanding, working on those scars, how it's going to change, the pull, the effect of what's going on. Some people don't want you, tattoos, other things, they don't want you touching them, they don't want you working on them, but you then have to be able to explain to them the scar is affecting them in this way, it's their choice. Or if you go to release, what is that going to do to that person, right? If I'm working on somebody's knee, which I'll mention, I'm going to talk about that later, I test that knee as I'm going. I don't just go to release the knee because I don't want to unstabilize or destabilize the knee because they have to get up and walk on it. I'm going to be testing as I'm going to see what's happening with that knee, and then giving them the right exercises and things to be aware of once they've left, of things that might occur while the scar tissue is releasing or dealing, or the body's adjusting to the change that I just made. Okay. Scars and adhesions are the same thing. As I mentioned earlier, no, they're not. It's not true. As I said, you can have adhesions without scars, but you cannot have scars without adhesions. Both need to be recognized. Both need to be treated. Right? In my therapy, we treat them, but you have to be aware of what they are. Some people can say they break down adhesions. Technically, that you could say that with adhesions, because adhesions are just a change in the chemical makeup of the tissue. The ground substance is changed and become thicker and stickier. In order to become adhesions, the body alters the area so that it can help and support the area. So as you work and you work to release it, chemically, it's altered and the body releases it. You will have some people that they'll be moving and all of a sudden they'll hear like a which could be an adhesion separating from what it's stuck to. So it can sound like you're breaking it down. That's a tear right there. Hopefully it hasn't done any other damage to the area. You still have to address the area, massage the area so that the body then reabsorbs and resets the consistency of the ground substance and makes it a more fluid tissue, bringing it back to its original state, if at all possible, okay? All scars need to be released. This is a very, very, very dangerous statement. Okay, first off, not all scars are a problem. some may be a problem, some may not. So understand, I'm not saying every single scar you have to work on, right? Not every scar, but you should test that scar and make sure that scar is not an issue. However, the fact that people think every single scar needs to be worked on is very dangerous. Okay, what if the only thing that is holding the knee replacement together is the adhesions that have formed around it? Let's say it was a crappy surgeon. He did a very bad job. So the body threw in all the adhesions and everything to help stabilize the body. And then you come in with your blades and your cups or whatever, and you start working and you go to release all the scar tissues. And then they go to stand up and they can't walk. You pulled the knee apart. All the stability is gone. They're not going to blame the surgeon for doing the bad job. The problem, you're the one at fault now. So when you're working a knee or a joint or especially anything that's weight bearing, you only work for a minute or two, and then you have to test to make sure that it's still a stable joint. If you don't know how to do the test in order to see if the joint is stable, the knee, the hip, the foot, whatever, the shoulder, you should not be working on it. Okay? Give a nice, gentle, light massage. Give a nice, if you want to do a deep tissue massage, but do not go at it for releasing the adhesions in the scar tissue if you do not know, A, how to test for stability, and B, how to stretch and strengthen afterwards, or be working in a PT or in conjunction with a PT or another strength trainer that once you've done the scar work, they're going to that person for the strength training. But you still need to know your basics, okay? You know, this is something to be considered before you pull out that cup and that tool and you start grinding away at the scars, okay? You must know you must understand the anatomy, you must understand how to test for stability, and also how to rehab as far as I'm concerned, okay? As I mentioned before, some people will say all scars are a problem. That's not necessarily, but all scars have a potential to be one and should be considered and examined. You should be testing and looking at every scar. And if this one's not a problem, it's not a problem. And by the way, you can have a scar from when you were 4, and because scar tissue spreads, scar tissue finds scar tissue via the tension and the pulls and the torsion in the body, that 4-year-old scar when you were 4 can be affecting the scar you got when you were 40, the way it's healing and pulling. And everybody thinks it's the new scar, and it actually stems from the old scar. So it doesn't matter how old the scar is, you can make a difference. You just need to make sure and clear the scars in the body, okay? And by the way, when I clear the scars, I also reset the sympathetic, parasympathetic. I do an acupressure treatment with my pens or with my fingers, because some of you may not know, but 80% of your sympathetic fibers for your sympathetic nervous system is in your skin. So people are already in sympathetic uptake. If they've gotten scar tissue, then even more so they're out of balance. So once I've released scars, I'm looking to balance out the sympathetic and the parasympathetic. How do you do that? That's to talk for another time, just sticking it out there so that putting it out there so you guys can start realizing the extent of which scar tissue work really goes. Scar tissue can affect every single system in the body. I can't say it enough. From the integumentary, the musculoskeletal, the nervous, the circulatory, lymphatic, respiratory, endocrine, urinary, excretory, the reproductive, digestive, your polarity system as well, your electrical system throughout your body. Every single system in your body is affected by scar tissue, whether you realize it or not. Okay? Understanding how each of these systems can be affected by scar tissue can lead you to unraveling the mysteries of the pain and frustration your client or patient has been suffering, in some cases for years. How many times have you massaged somebody or manipulated if you're a PT, and you're working on a shoulder or the neck, and you release the neck, and all of a sudden they say, my foot's not hurting anymore? Okay? Because there's a connection, whether it be through the circulatory, whether it be through the electromagnetic system, through the nervous system, there's something going on that you can release with massage. Imagine the release you can do with scar tissue. Okay? Every single system is connected to scar tissue. Okay? Education is imperative. If you haven't gotten that from me at this point, okay? Can you answer the following questions? I mentioned some of these before. How many different types of heart surgery are there? How many different types of reconstruction after mastectomy are there? How many different types of surgeries are there for spinal fusions? How do you test for stability of a joint? If you can't answer those questions, if you can't answer the first question, don't mess with heart surgeries, scars, no matter how old. If you have no idea how they're reconstructed, or the fact that there's over 7 ways to do reconstruction and not know everything about what those reconstructions entail, you're behind the 8 ball because you don't know how else to. You can be working the mastectomy, but they took a piece of the lat, and you're not looking at the reconstruction from the lat. Or for those who've had radiation, for those of you who work with cancer patients and you're working on the radiation, are you just treating the entry point, or are you treating the exit point as well? Yes, there's an exit point. What goes in must come out, and nobody pays attention to the exit point. Same if someone's getting shocked for an arrhythmia, they have had a valve replacement. They put them on a metal tray, and they're sending an electric shock through their system to reset it, and they end up with burns literally on their back. So if you need to know that so that you can treat that, okay? If you do not know the answer to these questions and all of the information that goes with them, then you should not be working on the scars from them. Can you do a light massage over them? Yes, but you should not be working with intention to release the scars if you don't know the answers to these questions, okay? There's a couple more questions. What are the different phases of healing? I asked you that before. When is the scar considered immature or mature? How many different types of scars are there? And how do they affect and how do they form? Again, if you don't know the answers to these questions and all of the information that goes with them, then you should not be working on scars with the intention to release them. Okay. Once you are informed of the specific surgery the client or patient has had or their accident that they went through, your next step would be to watch videos of that type of surgery to see the extent of the damage. If anybody hasn't seen a liposuction video and you're working with plastic surgery people and you haven't seen what the assault on the body from liposuction, which they think it's a major assault, then you can't really work on them, especially if you don't understand lymphatics when you're doing that as well. Okay, you need to make sure you look and also Google what kind of drugs are involved with it. What kind of drugs might they be on, okay? You need to consider all of the possible emotional, psychological trauma you're tapping into before you work a scar, okay? And most importantly, you need to be prepared for the possible reactions, physical and emotional, how to handle them for your own protection, right? And for that of your client and patient. And you need to be able to give them information about what they might be feeling or going through in the next day to week because of the fact that you've manipulated and worked that scar. You've literally poked the bear, and you have to basically make them prepared for it. They might not have any emotional reaction whatsoever. Others might have major and not understand what's happening. You have to prepare them for that, okay? Okay, if your chosen area of therapy is relaxation massage, then more power to you. Okay, not every massage needs to be a medical one, and everyone needs to take time to relax and release. Everybody needs a good, just rejuvenating massage. But if you're administrating a medically oriented therapy, then it's imperative that you as a therapist know who the person is, personality, everything. Have an understanding of what they've been through. I said understanding. You don't have to have been through it. I want you to have a decent understanding. And also how they came to be on your table before putting your hands on them. Did they get no therapy whatsoever? Were they made to feel everything was that they're crazy by the doctors? Were they put through a brutal physical therapy session? And I'm not poo-pooing PTs, right? I believe in physical therapy. I don't necessarily believe in all physical therapists or all chiropractors, people who administrate. There are some PTs out there that are very brutal, especially like when a knee replacement, the old school way to treat a knee is vicious. So you need to know what they've been through with their other therapies so you know how to approach them, okay? There are so many wonderful forms of therapy available today to help people on their journey to balance health and wellness, okay? No one therapy is better than the other. Rather, we have to find the right one or combination thereof that works for each individual, okay? That being said, there's nothing more important than recognizing the effects scars are having on a person. And here's the thing, some of you are just thinking about doing scars or what's not. Whatever your chosen therapy is, whether you're structural integration, whether your neuromuscular, any of the therapies, Swedish massage, Reiki, any therapy that you do, okay, all of them are great. Okay, but what I'm not saying forget about them, don't do them. What I'm saying is the first step to any therapy is to find, recognize, and assess scars. Treat the scars. Once you've done that, then any therapy that you love to do that floats your boat and agrees with your client, go for. But this is the one thing that works with every single therapy out there, is you have to clear the scars first. Or as good as you may be, you're always going to be leaving stuff behind, and also leaving the possibility that they're going to keep coming back, and you can't totally help them clear up the situation or the issue that they're experiencing. In order for any therapy to be fully effective, you have to clear and release any and all scars that are impeding the body's function. In other words, scar tissue release is the first step. Then you may proceed with any and all therapies that resonate with you and your patient, as I just said. Okay. So hold on one second. I'm going to unmute everybody. Oh, that's not the right button. Hold on before I knock you guys out. Unmute. You're all unmuted. Yay. Okay. So, does anybody have any questions? I know I just dumped a lot of information on you in an hour. Nobody?
How does this pertain for transgender men who've had full top surgery?
Transgender men, in other words, they went from female to male or male to female?
No, female to male.
Female to male. It's the same thing. Okay, first off, many of you will know that in your scope of practice, you're not supposed to work around genitalia. Okay? However, I would recommend to cover your bases. If you have a prescription, just like technically in New York, I'm not allowed to do breath work, mastectomy or whatnot. You need to have a script just to cover yourself. Okay, I just want to put that out there. Once you get past that, it works fantastic. It was very, very important to work the scars and help. Just have to be careful. You said female to male. With the plumbing, you have to understand how everything has been put in place and what's going on before you start putting pressure and doing pulling on things, because the scar tissue can wrap around, the adhesion can wrap around what's been put in. And if you're going to, and anyone else on that statement, if you're working on the male member, yes, we're not supposed to, but I have burn survivors and other people with issues where they've had surgeries or they even just had sports hernia where the scar tissue has traveled up the shaft. You can medically do that, you're covered at all times. You just have to make sure that you're secure with doing that. And if you're not, then don't. Refer out, okay? Right. And make sure you get, there's an understanding and that that's going on. And if at all possible, if it's a female working on a male, you want the spouse or the friend or the partner in the room with you, sitting in the chair, just so that there's no misunderstanding possible to happen if you feel any type of issue. But I'm assuming that was George who asked me that question. Is that the
no, the more so on once the breasts are removed.
Right.
I've been doing more AIS stuff with clients.
Okay, before you do the AIS, okay, you need to release the scar tissue. AIS is fantastic. That's for those of you who don't know what AIS is, because we're such an industry of acronyms. That's active isolated stretching. Therapeutic stretching is massively important once the breasts have been removed. But before, what I would do, depending on the person's how they're dealing with it, I would work the scar tissue. Make sure you need to release the scar tissue off of the breastbone. You need to release the scar tissue that's on the between the intercostals. You have to release the scar tissue that may be with the diaphragm. Okay, and then you're going to do the AIS. And in fact, if they can't take a lot of scar tissue, some people can only do a little bit of scar tissue work at a time. So you do a little bit of scar tissue, you do a little bit of stretching. The stretching is two things. It's going to enhance the scar tissue release, because as you move and as you get more movement and the tissue starts to move, some other adhesions and scar tissue may release on their own from the proper movement. Okay, the other thing is you're resetting from the compensations caused by the restrictions of the surgery. Don't forget they had their arms out while this was happening. Don't forget the drain scars, because you know they put drain scars in after that too. The drain scars and port scars are some of the most vicious scars. out there, both physically and emotionally. They're the smallest scars, but they cause the most damage. So you want to look for the drain. And by the way, if you don't know enough to ask or look for the drain scars, do not work with someone who's had mastectomy, okay, whether by choice or by not. You're welcome. Where was everybody who's saying thank you? You're welcome. Okay, so this stretching is massively important, but you're behind the 8 ball. Release the scar tissue first, then reset and open and fix the range of motion with the AIS afterwards. Perfect tool to use, but it's secondary to opening up the scars. Does that make sense?
Yes.
And don't forget the back. Don't forget the lats. Don't forget anything in the back. Look for scar tissue back there as well. Look for where the tissue's traveled. Okay, because again, the restriction from having mastectomy, whether voluntarily or from cancer, the pull and the tightness is affecting everything, the traps and the lats and the rhomboids and all the neck muscles. Okay, is it possible to release it? Okay, and before I read that question out loud, did I answer your question?
Yes.
Okay, so the next question that popped up on chat, for those who aren't looking at the chat, is it possible to release the uterus from the abdominal wall after version? C-section, thank you. What is that word? Okay, so 2 things with scar tissue when it's very deep and it's abdominal. We work layer by layer by layer by layer. We don't just go for broke and try to like get it from inside out. It's from the outside down. As you're working and you're moving and the pull can actually reverberate down, yes, it can get released from the uterine wall for that reason. However, there's only so much that we can do. If you're not a visceral manipulation person, if you're not trained in PM, know somebody who is. If you're doing this kind of work, because sometimes I'll get in there and I'll be like, there's just so much I can get to, and while I am trained with visceral, it's not something I do all the time. I'm not the greatest at it. I'm good at it. If I feel I'm not quite getting there, I will refer out to someone who's really, really good with visceral manipulation. What type of therapist do you suggest? You're fine as a therapist, but I would recommend we do the scar tissue work, and then if you can't get everything, find a good visceral manipulation therapist. Does that make sense to everybody? Everybody in here should have a huge contact list in their phone. I used to say Rolodex, but apparently that dates me more than the gray hair. So in your contact list, you should have every type of therapist that you know and trust from every type of therapy. You should have a PT that you trust. You should have a chiro that you trust. You should have a doctor and a nurse practitioner. A psychologist, everybody, you should have someone in every type of profession that's a personal trainer, everyone that you can work together as a group and share with the patient, because there's sometimes you just have to refer out. I refer out to not called vaginal PT anymore, pelvic PT, when I'm working with C-sections, because if they've had an episiotomy, that's not a place that I can go. My rule of thumb is, all puns intended, my fingers don't go anywhere I can't see them. Okay? Some of you do great oral work. That's not my boat. I refer out. Someone's got palsy, Bell's palsy. I'll do what I can do outside, but those pterygoids need to be addressed from the inside. I refer out to someone who does oral, right? If it works in here to the cavity, not over here, in the mouth. Okay, so understand you should have a very good list, and understand that to the point where you can do so much, you can make a huge difference. The person with the bells, I'm doing stretching. I'm doing my own form of therapeutic stretching, which is based, my AIS person in there, it's based off of AIS. So I used to train in that. I did that for many years, and I've kind of altered it a little bit. And I'll add jaw stretching. But then if it needs more, I'll refer out. Never be afraid to refer out. Have yourself an amazing referral network. Even if it's not to refer a patient out, it's to pick up the phone and call and say, hey, what is your point of view on this? Question is, have you worked with hip labral tear? Yes, I have. If the tear, are you talking about an active tear or one that's scarred over? If it's about one that's an active tear and currently torn, at what degree is it torn? How bad is it? Is it a shoulder tear? Scarred over. Okay, no problem. Yes, I do work on a labral tear with the hip. A lot of it is range of motion and stretching, but I get in with the scar tissue. For that matter, anybody that has a tear, Achilles tendon tear, rotator cuff tear, and it's an active tear, you need to know the level of degree of that tear, that you know how much you can work with it. And if you don't know that there's different levels and degrees, don't touch. Anybody else? More questions? No questions? Okay.
I have a question about the labral tear. Can you hear me?
Yeah, I can hear you. Go ahead.
Oh, good. Okay, so about the labral tear. So, you know, some would say you need a MRI with contrast. Some say would no, you can just do by, you know, checking the, you know, just a manual, looking at them manually. What do you recommend to see the degree of the labral tear? Or how do you know?
It's extreme pain or having pains. You want to be, especially for our profession, because we're manipulating, you want as much information as possible. So if they don't have any history of allergic reactions to the dye, they're not afraid of going into the MRI or anything that they're having done, I always recommend that they get it done. And then if it's a severe tear, then it's either you have to refer out as a massage therapist or wait to a certain point of the tear to fix. But in the interim, if the tear is severe and you can't work on that area, there are different areas of the body that you need to work on due to the compensation that they have from the way they're walking with the tear. Does that make sense?
Yeah, because now there's back pain with it. Yeah. Because there's labral tear, arthritis, and now there's back pain.
Right, so that's going on throughout the body. Right? So, and it's affecting the rest of the body. So you can treat the rest of the body while that tear is healing, and that's going to give some relief. The other thing is to make your client aware of how they're using their body, how they're compensating because of the tear. Right? They may not be able to stop their compensation because they're shifting their weight, but then they have to know how to stretch and take care of themselves at the end of the day after moving around all day in a compensated way to keep the other side from going. Physical therapy or physiotherapy in almost every country, almost, like South Africa know and a couple others know, they can only work by they can only do prescription on the area, they can only work on the area prescribed, which is usually the injured area. If you have a bad hip, nobody pays, the PTs do not pay attention to the other hip, they do not pay attention to the back, or the knee. They can't. They need to fix. Whoever's got that really bad background noise, so you use your mic and distribute it. You can hear someone having a conversation behind you. Okay? You have to pay attention to the rest of the body. PTs get their hands, tied with it. The other thing, though, is the PTs can recommend that the patient go back to their doctor and ask for a script for the other side to avoid injury on the compensation side. Because within 6 months of that hip surgery, that knee surgery, or that hip tear, they're going to end up with issues in the other hip, the other knee, right? It needs to be paid attention to, and that's where we come in. That's our strength. We're allowed to look at the whole body, not just the injured area, right? So please keep that in mind. There's always something that you can do. There's always a part of the body that you can treat when you're waiting for something as a severe tear. But again, know your limitations. If you're not aware of how to treat those areas, don't do it. Refer out. Does that answer your question?
Yes,
awesome.
Thank you.
Anyone else? I didn't figure any other questions? No? Okay. Because you've got that one person whose mic is making a lot of noise. Okay. So, just so you guys know, if you guys want more information in regard to me and or my continuing education classes, in scar tissue release and integrated therapies, and the scar tissue release, in the ITS, the integrated therapeutic stretching, or body mechanics. Yes, I teach body mechanics to my clients and to my therapists. You can visit my website, which is Marjorie Brook, no E's, seminars.com, or you can go to my Facebook page, where a lot of you have found me. Anybody looking for private sessions, I am doing virtual sessions right now, both in training, discussing things with patients, consultations. I'm also working with patients, teaching them stretching and all of that, so people can call and book, go to marjoriebrook.com and get information for booking virtual sessions. Other than that, if nobody else has any questions, hold on, I sat on this too long. There you go. Okay, I want to thank everyone for joining me. We had about a little over 30 of you jumping in. I hope most of you did okay with the Join Me app. Some people have had issues with it. I like it, again, because I've had no limits. If I was doing Zoom, I'm in and out in 30, 40 minutes, and then I don't like to do that. I like to give as much time as possible because I don't know if people are going to ask a lot of questions or a few questions. I am always available for consults and talk. You got a quick question, I'm not asking you to book a whole Skype session or a Zoom session with me, or join me session. You can just always contact me with a quick question. If you're not one of my students who are in my straight group, if you're on the Brook Seminars page, feel free to post there. Feel free to email me, to call me. I'm always around and available. And it doesn't have to be about scar tissue. Many of you are freaked out about going back to work. You can call and talk to me about that. Many of you have other issues going on in regard to therapy or whatnot. Feel free to give me a call. You have questions on other therapies, whether you think it's right for you or not, or you don't quite understand what these other therapies are that you're interested in learning. I am always available to explain exactly what a therapy is. No bias. I do not have a bias against any therapy. Like I said, if I do, it's about the therapist who's applying it, not about the therapy itself. Yes, there are a couple of them out there that I would say run away from, only because the history behind it is not good. But I will always tell you good, bad, and ugly. I'm very straightforward, so please feel free. You can always call me about that. And always people trying to, see, I said that, now people are trying to call me. Don't ask questions yet. With that being said, I do have a YouTube channel where there's really old videos. There's some new videos and there's some old videos of me teaching the stretching. Back when I used to call it AIS and sometimes when I call it ITS. There's some a few things. There's one video of me. Yes, that is my phone number, viewer 53. That is my office number. Yes. I currently have it forwarded to my cell phone because these days I'm not getting that much. The YouTube videos are there. I have me discussing with a couple of things. I'm going to pop a couple of other ones up there. And no, I do not have an online training at the moment. You're welcome, Jane. I saw the message. I have a problem with online training. I'm being dragged into it, kicking and screaming. I do not believe hands-on therapy should be taught online. Hence my client who got hurt by the person who watched the cupping video. I will, though, be converting the lectures for a lot of the SCAR classes are very lengthy. You get tons of hands-on. You get to work on every type of SCAR because I bring people in for you to work on. You're not just working on your partner. Don't you hate that? You're in a class and your partner doesn't have the issue that you're working on, so you really don't feel like you've had the opportunity to ingrain the work. Well, that doesn't happen with me. We bring in every type of SCAR possible for you guys to work on, and you get 3 days of hands-on. You get working on each other, and you get 2 days of clients coming in for you guys to work on actual patients that need SCAR work. Some that have been worked on before, and some that have never, ever had any SCAR work at all. You're welcome, you're welcome, you're welcome to everybody who you have that. Thank you for sharing your information. You're welcome to everybody who's popping off. But I was bringing in and you learn. But I have a lot. If Barbara's on here, Barbara's shaking her head. I give you tons of information. My handouts are this thick. How do you find referrals in other states? You mean how do patients find other people? They can go to my site. I have Find a Therapist, but I will tell you right now, that Find a Therapist list is very, very, very small because I don't put every single student who's ever taken my class with me on my website. I put the people who I know I can trust. But if you contact me and your state is not on there, I will find somebody in that state if I have somebody in that state for you. I do not believe in just letting people pay me to put their names on my site, and I do not believe that everybody who takes one course deserves to be listed on my site as a practicing therapist. It doesn't work that way with me. You have to prove to me that you're actually doing this work and that you know what you're doing before I will put somebody in your hands. Because I will tell you right now, ladies and gentlemen, you can seriously mess somebody up doing SCAR work if you don't know what you're doing. And I don't ever want to put a patient in that position, and I don't want to put a therapist in that position who thinks that they're good enough or confident enough to do something. I will tell you that when you leave my class, you've had enough hands-on and information that you will be confident to start working on it with SCARs, but it takes practice and it takes dedication. Barbara's shaking her head. She'll tell you that in the straight group, which is the closed group for people who have taken my courses, because due to HIPAA rules, that group is closed. You get invited into that group once you've taken the class. There are amazing therapists and doctors and OTs from all over the world sharing information. We're sharing about clients, what to do, how to deal. And it's an incredible group. Every type of therapist you've ever imagined is in that group, and doctors. So It's very, very important that you understand. And in regards to lectures, my lecture part, as I was saying to viewer 19, I am thinking about, and I'm going to convert my lecture part of my classes into an online that you can listen to me. It's kind of boring because I'm just talking like this and we don't get to interact, because I love to interact, but I'm going to put it on there. I'll be as bubbly as I can, give you all the information. You can take the little quizzes. Once you've taken that, I'm still not giving you your credit. You still have to show up and do the live hands-on. But instead of coming for a 4-day class, like my 3-day is quickly turning into a 4-day class, and I have multiple other levels of classes. Yes, I have advanced classes. It's not just one. There's a lot of scar tissue classes out there right now that are 1 day. 1 day and you're certified. No. I have multiple levels, multiple day classes. So I will give you the chance to do the lecture ahead of time. You have to pass the test. And then when you come, then you still have to show up for at least 2 days of hands-on. But it's saving you the 4-day and the massive travel. That's going to change my schedule, because for those who want to come to the full 4-day live, I don't just have 2 days, 2 days of lecture and 2 days of hands-on, because I'll drive the people listening to the 2 days of lecture crazy. We break it up throughout the day. So I will have specific classes for the hands-on, and those classes as well. If you took the live classes with the 4 days and you want more hands-on with me, you can come to the live hands-on part 50% off and have more hands-on overviewed by me in there. It's really an amazing experience. Barbara's eating, so I'm not going to ask her to open her mouth. I'm just picking on Barbara because her bubble is up in front of me. But Barbara will tell you it's invaluable having the clients come in, tell you their stories, and getting to work. And you don't just stay with one client. I rotate you around. We try to get as many clients in as possible, like at least one per table. So if there's 2 people at a table, but sometimes I've had it where I've had one patient per therapist, and you're rotating every 20 minutes to a different person with a different scar. So you get your hands on and you get full experience. So no, you don't get to work with burn patients for like an hour and then you're all of a sudden working on, shoot. Can you guys still hear me talking?
Mm-hmm.
Yeah. Okay, because somehow I let Jane be the presenter. I didn't mean to do that. Jane, throw it back to me. Because I just lost my screen share. But that's okay. Hold on. Put screen share. Oh, that was nice. Now I can see all you guys bubbling around and moving around. But I'm just screen share back on. So Jane's got to pass it. Otherwise, you're not going to see my last slide. But that's okay. I'll get rid of screens. I'll pause screen share so I can see all of you. Okay, there we go. So, what was I going to say? So you get a lot of experience with the live classes. And for those of you who haven't taken my stretching classes, Barbara can also tell you the stretching classes are massively intense. They're almost the opposite of the SCAR classes. But we do have, there's over 4 hours of lecture. Yes, I can talk about stretching for 4 hours. And stretch. In fact, my lower body class has gone from your typical 16-hour 2-day to a 24-hour 3-day. So we spent a lot of time on body mechanics. It's not just that I demonstrate and say go do. Doesn't work that way. There's a lot of hands-on. I'm coming around, wrapping myself around you because it's as important to know your own body mechanics as it is to know the body mechanics of a client. Many therapists do not realize how the way they're standing, moving, and leaning over the table or on the table is affecting the client. And the hardest thing with my form of stretching, active isolated stretching, which most of the AIS people don't understand, and the ITS, is that once you're connected with somebody, you have to watch how you assist. You're going to alter the stretch. Okay, and you have to let the patient, client, do the action, and you're just the assist. It's a very, very hard thing for therapists because we're used to working and manipulating and being the one in control. You are not. You are the guide. You are the assist. You are rehabbing and reteaching that body and that person how to move properly. So it's a very big thing. We spend a lot of time with that to make a difference. And then you get to see, and for those who have taken my classes in the upper level classes, the advanced classes, say the thoracic class or the abdominal class, I don't go over scar tissue again. We review it if you guys need it, but we talk about all the different surgeries, and then I'm bringing in the patients with the third surgery. Then we have, everybody does a scar tissue round, and then you group in 2 and 3, and basically You guys work with the patient. Now, how are we going to rehab this patient? What does this patient need? What are they compensated? What has happened because of the scar tissue? What do we see? And then you're applying either the ITS, strengthening, stretching. We could be doing body mechanics. We could be doing a little original strength, some rolling, rocking, and crawling, whatever that person needs. John, you're welcome. Any of those things will be done in the advanced class. A lot of people think they can just skip over the beginner and show up for the advanced classes. No, because we're not teaching you the scar tissue in those classes. The scar tissue is in the foundation. Does anybody have any questions about the classes or future lectures or anything like that? Okay, well, I've kept you guys here. I'm glad. You're welcome for the information for those that are clapping and those that are on the chat. Is there a question there? Okay. I just hear people talking in the back. I did record this. I'm going to get it up in a couple of days for the Southern Hemisphere. Like I said, I'm not getting up at 3 in the morning anymore so that they can hear it. Done enough of those. Again, once we get the replay up, please tell people to listen if you found value out of this. I'm really, really happy. If you hated it, you can text me and say it sucked as well. I really don't have an ego. It doesn't bother me. If you didn't like it, tell me why so I can seriously look at it and make changes. And on top of that, from the bottom of my heart, for everybody that took an hour and a half or so out of their day to sit with me and talk with me and listen to me prattle for an hour, thank you so much. That I release you. I normally have a very funny little screen in the background, but unfortunately I handed presentation over to Jane and now I can't get it to show up. So with that, enjoy everybody, and I hope to hear from you, see some of you in classes. 18, I can't wait to see Anna in Illinois. Hopefully we'll be open after all of this crazy pandemic and then we can work. Enjoy everybody. Have a great day.